Have you maybe gone for a hair transplant and are a little bit less than satisfied with the result, that could perhaps have left you feeling even more insecure than when you started? So today we're going to be talking about botched hair transplants, and if you're one of the unlucky people to have had this yourself, what you could potentially do to correct this. Currently, hair transplantation is the #1 most Googled cosmetic surgery by men around the world, and this is because it's becoming more and more popular with the advent of less and less invasive techniques. With hair transplants becoming an absolute commodity in certain countries around the world, we are seeing more and more horrific results, and I would say currently up to about 50% of the patients we see in our practice are for corrective surgeries. I'm going to describe today the most common mistakes we see in these botched hair transplants and what our approach is to correcting them. So by far the most common mistake we see in patients is unnatural hairline. This is way more common than one would think, and the reason for this is because most people don't understand what a natural hairline is supposed to look like in the first place before it's too late. Patients are usually easily fooled into thinking that results on social media look really great because the patient was bald before and now he has all this hair and it looks wonderful, the hair has grown. But what they don't realize is that this patient constantly has to do hairstyles that hide this unnatural hairline. Usually this unnaturalness is caused by technical issues during the surgery. So the #1 most common thing is an unnatural placement of the hairline and hairline design. So if the hairline doesn't suit your face and it's placed in the wrong way, it's going to look unnatural. Secondly, it could be due to multiple hair follicles in the front line. Now, it is extremely painstakingly difficult to ensure that only single hair follicles are present in your front line. And if you don't have a clinic who places a large emphasis on this, well, you might be stuck with those quadruple, triple, and double hairs in the front line, which gives that hair a very hard and pluggy doll's hair appearance. Also, let's not forget to mention that a lot of times we also get the wrong hair angles and directions, and this can make a hairline really look bad. So how do we go about correcting this? Well, we pretty much have two groups of patients, the lucky ones and the not so lucky ones. And let's talk about both of them. So the lucky ones are patients that, yes, they have this unnatural hairlines, they have all the wrong angles, all the wrong directions, bad hairline design, 4-3 double hairs in the hairline, but the hairline was placed high enough. And those people are extremely lucky, because how we'd go on to correct this is pretty straightforward. All we would do is slightly lower the hairline, refine it, so create pretty much a new hairline in front of it that looks natural, that has the softness to it, and all those unnatural hairs are behind it and just hidden in general density. So those lucky people are pretty straightforward to correct. However, more often than not, hairlines have been placed way too low, which means we can't lower it any further. And those patients are extremely difficult to treat, but we do have methods in order to treat this. What we first have to do is remove the offending hairline before we can go in and reconstruct it, and this may take multiple sessions over a couple of months to get right. So there's two ways to really remove this offending hairline. What we always first try to do is take a very small diameter punch, just like we remove the hair from the donor area, and punch out these offending follicles. This is easier said than done because a lot of times the angles of these hairs placed in the front are unpredictable because of fibrosis and healing. So sometimes we try extract them and they don't fully come out. If we experience this, what we do is draw on our new hairline and then send our patients to a very experienced laser clinic where they can actually just get those hairs lasered off, and this might take a couple of sessions that you have to go in for. And once those hairs are removed, we can then go ahead and reconstruct your hairline. But once again, this is probably easier said than done, and that leads me to our second most common complication, which is donor area overharvesting. Now, it's all well said and done that we can, remove the hairline and create a new one. But what if you don't have any donor hairs available? The reason this overharvesting is happening is because many commercial clinics employ extraction technicians. Now, these extraction techs are extremely overworked. They have to extract thousands of follicles from up to 4 patients per day. and they need to hit a target. This patient was promised 3,000 follicles. The other patient promised 4,000 follicles. They have to extract that amount of follicles. Now, when they're just punching out follicles, if you have 8,000 available, they might not care if they destroy half of the follicles while trying to get that 4,000. So we've seen a lot of patients who say they've only had 2,000 follicles done, but when we look at their donor area, we can see that 5,000-6,000 follicles have been completely obliterated. Now, if you're left with an unnatural hairline, an unnatural result, and very little donor area available to cover it, well, now we're really in a problem, and this is where we really have to think outside the box. So a lot of times what we do is go for body hair. The first area we'll go to is beard hair under the chin. You can sometimes get up to 1,000 follicles for that. I've heard of some doctors getting even more than 1,000, but we don't really like to harvest beard from the mustache or the facial area. So we typically only go for chin and underneath the chin because scarring is a lot less and it can be a lot less visible as well. The second area we'll go for is chest hair, but we can't go for chest hair on everyone. You really need to have thick and really good chest hair for us to attempt to extract it. Now, unfortunately, if you don't have beard hair available, if you don't have donor hair available, if you don't have chest hair available, your only option might be scalp micropigmentation and shaving your hair. Maybe a hair system as well. And guys, we also see this a lot in very young patients who just get a hairline correction. And they think, oh, 2,500 follicles, 3,000 follicles, let me just correct my hairline at 22, get it back to my hairline when I was 17, 18 years old. This is a big problem because a lot of times these patients have not been properly assessed and they've not been given the proper advice to be on lifelong medication. So these young guys will get this awesome corrective surgery in the front. 5 years down the line, their balding has severely progressed to becoming Norwood 6, Norwood 7, and they really just don't have the donor hair available to correct that surgery anymore. So with little to no follicles available to correct this, a lot of these young guys come to us just wishing to look like a regular bald person again and not a bald person with a funny, unnatural tuft in the front and a lot of scarring at the back. And finally, the last type of complication that we tend to correct is scarring from skin necrosis post hair transplant surgery. So if hair transplants aren't performed correctly, or if you're just one of the unlucky patients, you might get an area of skin that literally loses its blood supply and dies off. This tends to leave a really nasty wound that takes time to heal, and eventually it will scar over with no hair growth in that area. What we like to do in these areas is first prep and treat the scar depending on how bad it is. We usually treat it with some stem cells and nanofat in order to gain vascularization to the area. So we want to increase the blood supply to the area before we go and try reimplant hair there to ensure that they survive. So guys, I think my take-home message is don't forget that hair transplantation is probably one of the most technically challenging plastic surgery, and in my opinion it requires a great deal of artistry to actually get correct. So make sure you do your research thoroughly before you go for any type of surgery, and just remember that even if your friend got a great result, it doesn't necessarily mean that you will. So don't fall victim to increasingly smart and manipulative marketing. And if you're one of the tens of thousands of unlucky patients to have had a botched hair transplant surgery, don't worry. Typically there still is hope, and there's a lot of fantastic, real qualified hair transplant surgeons out there who'd be more than willing to help you.